All right, you ready?
Let's do it.
All right, guys, welcome back to the Atlas Hour. This is episode 14, and today we had a special request from a James Standifer. Hope I'm saying that right, man. But you had wanted an Atlas Hour on fat loss, and so today we're going to talk all about fat loss. Pretty much eat less than you burn and you'll lose weight. So that's the end of the episode, guys. We will see you guys in the next one. No, I'm kidding. That's it can be a little bit more nuanced, and that basically gets to the core of fat loss for sure. But Josh and I can talk to you a little bit about various ways that one could do that, ways that you could be consuming less calories than you're burning, and then different modalities. We can maybe talk about supplements and our own experiences and how we've lost weight. I mean, Josh has been at the competitive level of bodybuilding, shredded, as Derek would say, shredded to the gills, and the more plates, more dates connoisseurs love to say when they come into Marek. I always know when they're a Derek fan when they say that. But yeah, so yeah, where should we start? I think just talking about the science of that, it truly is, you need to be consuming less energy than you're burning. And just a rudimentary crash course on that, a calorie, which a lot of people know the name, not everybody knows what it is. A calorie is simply a unit of energy. So it's nothing like mysterious or crazy. A calorie is, it has to do with how much energy it takes to heat some water as to a certain degrees. You don't have to worry about that, but you can literally just think of a calorie as a unit of energy, just like an inch is a unit of measurement. You're just measuring how much energy is contained within that amount of food. And so we all have a certain amount of calories that we burn at baseline. So if we were just existing, which would be considered your basal metabolic rate. So that would be, I kind of think of you just laying in bed, not moving at all. That's how many calories your body will burn in a day. And then you add on just basic movement, and that's movement, walking around the house. That's movement, moving your hands, any twitches and things. That's movement, standing at your desk or working, or even eating burns calories. That all adds to that too. And that you can usually find as a TDEE, what's that, total daily energy expenditure. And I think as somebody starting out, if you're trying to kind of see how many calories do I burn throughout my day, getting a basal metabolic rate is okay. It's a good start, but that's not going to include your normal day-to-day activity. So I usually will direct people towards a TDEE calculator. And then I would always, personally, I think it's better to err on the underestimating. So that's to say, like, it'll ask how many times you exercise. And a lot of people are quick to say, like, strenuous exercise 5 times a week. But if you really think about it, maybe it's not. And so I will usually err on maybe moderate exercise 3 times a week. When you're looking for fat loss, it's always better to kind of undershoot your energy exposure.
Agreed.
Or energy expenditure, rather. Yeah. So
Especially
I think
when
that
it's
would be
self-reported like that.
exactly. So that would be a great place to start. And then from there, basically, like we said, to lose fat, you need to be consuming less calories than you're burning. So let's say that, you do the TDEE and it comes out with 2,500 calories. I personally feel like a good place to start is maybe 200 to 250 calories under that, and just start for a little while. It might even be a good idea to run the calories that it told you your maintenance was for a few days and see if it is maintenance, maybe a week actually. So I would probably do a week of, if it said I burn 2,500 calories a day, do a week of 2,500 calories, weighing yourself every single day in the beginning of the morning, like after going to the bathroom, before eating any food, and then take a weekly average, because your weight will fluctuate based on the salt content of the meals in the day, or the sweat, or various things like that. And so if you measure your body weight every single morning and then take the average, you can kind of see. And if you haven't gained or lost any weight in that 7-day period, it was probably accurate. If you gained, then maybe your TDE is actually a little bit lower. If you lost, maybe, So I think that would be a good place to start. Would you agree?
Absolutely. And I think just for a lot of people, even just having like a gauge of what that's going to be is just a great starting point. Because I think some people haven't, for some people, they've never maybe even tracked that to begin with, what they're even eating on a day-to-day basis. So it just gives them a starting place, and then can kind of, move from where they need to in either direction.
Exactly.
And I think for some people, even 2,400 calories, they may think like there you might even be someone who's under eating with that, and that may feel like you're like almost having to force yourself to eat that much. So it
Yeah.
kind of definitely like gives you a good indicator of where you're at, or just a starting point.
Yeah, exactly. So, after I would say, I think around 200 calories is probably fine. I would
Agreed.
reduce it, to 200 calories. So you went from 25, now you're eating 2,300 calories, and do that for a few weeks and do the same thing, weighing yourself every single day. If you're somebody who is not kind of like us and doing this for more of just fitness related goals or aesthetic goals, but if you're somebody who's really struggling with weight loss, or you have some like eating disorders, or you have some anxiety around your weight, weighing yourself every single day can be kind of stressful.
Hmm.
And some people will, like dietitians will urge people not to weigh themselves. So if you're somebody who's falling into that camp, I'm going to say this whole talk probably isn't for you. Just meet with a professional and work with,
Yeah.
a therapist and a dietitian and stuff. So this is gauged more towards the people who have, I don't want to say a healthy relationship with their body, but I mean, no bodybuilder or anything does, but
Yeah.
guys who are not going to stress about that. But the weighing yourself every day during a fat loss period is good, because like I said, if you weigh yourself one day and you're 190 and you think you're in a weight loss phase, and the next day you're 193 and you're like, holy shit, that could freak you out. But if you actually took the average, there's probably a day in there where you're 187. And so it all equals out.
Yeah.
Um, but as you continue to reduce those calories, another thing is tracking, and tracking is going to be huge, which you mentioned. It's good for people to start to do that for once, because they probably never have. And when it comes to tracking, it's an art for sure. There was a good study where dietitians underestimated the calories in food by around 10%. So these are
Hmm.
people who, their career is based on looking at food and measuring food, but they still underestimate calories. So it's not something that, somebody has to do forever. But I think that it's good that people track their food and measure their food for at least a few months out of your life, just at least one time, because a lot of times we are either under or overestimating our food, usually underestimating. And that's why so many people tell you, I'm eating in a deficit, but I'm not losing weight. So measuring too, it's not, to be accurate, I think you really need a scale and get a good food scale, because
Absolutely.
a cup of oatmeal can be so many different things. Is this a rounded cup? Is
Hmm.
this a little bit? So it's a lot better to say the serving size says 56 grams and pour out 56 grams. See what it
Yep.
is like.
Yep.
And this is how much I've tracked. Like, I know a serving of pasta 56 grams because I tracked for years.
Yep.
And 56 grams of pasta, you're going to literally laugh at it and be like, are you kidding me? It's like 3 bites. And so you think when it says 56 grams, a serving of pasta, you're thinking, okay, that would probably be like a bowl. It's not. It's
No.
like a quarter of a bowl.
No. Yep.
You literally pour it out if you're doing like a macaroni style, and it's going to be like 3 or 4 noodles. You're like, what the hell? So
Yep. Yep.
it's good to do that and get an eye of that. Same thing with things like nuts or peanut butter, things with fat that have a lot of calories in them. It's going to be really good to actually see what they look like measured out on a scale. And again, this can lead to pretty excessive, obsessive behavior, and might not necessarily want to do this forever. But I think it's important for everybody to at least do for a few months out of their life to really see serving sizes as they are.
Yeah. Yeah, no, and it's just a great learning tool to your point. For most people, it's kind of a culture shock. Like, oh my gosh, that's like a half a cup of oats. That's it. And
Yeah.
just seeing that, and even more so with kind of more what I would refer to as snacky foods with oats, or not oats, almonds, things like that. Being able to see like how small that serving size is, your hand, and as Adam's saying, some people can become obsessive compulsive about it. So you do have to kind of like gauge yourself on that. Like, am I becoming a little too obsessed as I move along this journey? And if so, it's okay to not track every single thing, but there also is added benefits to just kind of learning those things. So I think it allows you to then intuitively kind of restrict yourself when you need to, as far as serving sizes going forward. Because I know for you and I both now, neither of us really track, but we have a general idea of like how much to eat, whether it's going to be a fat, protein, or carb, and how much of it in that meal, just based upon years of doing it and tracking in the past.
100%. So yeah, where are we? You reduce your calories by a few hundred points, and I would continue to do so until you until you stall again. So when your weight
Yes.
is, if you've hit 195 and you've stayed 195 for 2 weeks, you've now hit a new maintenance. So your new maintenance 2,300 calories. Time to drop calories again. And I like to do it slow that way too, because some
Hmm.
people will get too aggressive, and our body is adaptive. And people talk about metabolism slowing down, which if you get into the nitty gritty, it's not actually true, but it does kind of adapt to what you're doing. And it will, if you drop your calories too quickly, you run out of calories to work with.
Yep.
So another little hack that I like to do is in your off season or whatever have you, try to build up your calories as high as possible, almost to where you're force feeding yourself. So you start with a massive abundance. Like when there was times when I would bulk, my calories would be getting upwards of like 5,000 to where it was uncomfortable to eat. But that was just me trying to like maintain or gain weight. So that meant that when I went to lose weight, I could literally pull out 200 calories from 5,000. I still had 4,800 calories that I'd start getting lean on. And so that's kind of another hack too. You always want to, in your off season, if you're an athlete, if that's who we're talking to here, try to push those calories as high as you can while staying lean, of course. But yes, that slow pulling out of calories, I think, will help. And then I guess the question would also be like, how should people distribute their macros? And I know this is something that people get kind of really into. And I would say it really doesn't matter. I would
Hmm.
say hit your protein requirement first. And general
Yeah.
rule of thumb, especially when losing weight, is like a gram per pound, and that's going to be
Yep.
overshooting protein requirements.
Yep.
Because in actual, like, to maintain muscle mass, it's like 0.8 per kilogram,
Hmm.
so it's going to be significantly less than a pound. So you can just say 1 gram per pound. You're going to be overshooting protein, which I think is important in a caloric deficit, because our goal with weight loss is not only going to be to lose fat, it's going to be to preserve muscle. So
Hmm.
you want to try to do everything you can to preserve muscle, which is eating high amounts of protein, probably protein almost in excess, and then resistance training, and continue to lift heavy.
Yep.
People used to kind of feel like their training should change when they were dieting. They would try to do higher reps and more endurance stuff, and could be okay. But if you're, I would say, stimulate the muscle in the same way with the progressive overload. So even if it is higher reps, continue to do progressive overload. If you want to work in that higher rep range, it's fine, but just continue doing progressive overload, so you're at least maintaining muscle mass.
Yeah.
So
Absolutely.
I would say the protein, hit the protein first, and then
Hmm.
you can fill in your fat and carbohydrates however you like.
Yeah. Well, and then correct me if I'm wrong, but then the added thermogenic effect of a higher protein diet too, another added benefit as well. So you're obviously burning a few more calories there just with your body having to break down the protein for energy as well.
Yeah, so
Um,
thermogenic effect of food, like Josh is talking about, is basically how many calories does it take to break down and metabolize and utilize a food. Protein is one of the hardest to do so with. And so essentially, the more protein you eat, kind of the more calories you're burning there. So yeah, that's what Josh is getting at, and it's true. So and it's highly satiating. So another thing,
mhm.
the more protein you eat, the more full you feel, and it's all going to be about how can you keep yourself as unmiserable as possible while you're dieting.
Yeah, absolutely. Should we the nuance between different types of protein, or you just want to leave it at just protein as it is, like between animal and plant based?
Yeah, I mean, I think that's a good topic. I don't know how much of an authority I am on the subject. I think it's well known that animal protein is probably a bit superior, but I would
Hmm.
say that I think that you can make plant protein adequate enough as well. You just have to be a little bit more mindful. So there's going to be amino acid content profile or amino acid profiles in each food that you have, meaning, there's all these amino acids that make up a protein, and you need to have a certain formula of amino acids in order to have what's considered a complete protein. Animal food or animal protein is a complete protein. It has all the essential amino acids that one would need, which makes sense. We're eating muscle meat and it's going into a human to make more muscle meat. When it comes to a plant, they don't always have that. And so you need to be mindful. And that's where, if you are a vegan or a vegetarian, you just need to be a little bit more mindful of this stuff and start breaking down protein at their actual amino acid level, and then mixing proteins. So that's why people talk about beans and rice, because beans have X amount of amino acids and rice have the other ones, and you combine them and now you have a complete protein. So that's where that idea comes. So I think it's totally possible to have a good physique and
Hmm.
perform well and be healthy on a plant-based diet. You just have to be a little bit more mindful than the omnivore or carnivore crowd would be.
Yeah.
Would you
And not
agree?
to get oh, absolutely. And I didn't want to like make wasn't trying to make any hard stances about either. I just feel like that's a common question people have when it comes to if they are going to follow just an entire plant-based diet. Should they approach their protein requirements any differently? And I've heard, other people are kind of more experts, obviously, about it than I, say that if you are going to go head to head, you should aim to get a little bit higher as far as just grams go with plant protein, just to kind of offset the difference of maybe some of the amino acids that you're going to be missing out on from a
Yeah,
animal-based side of things.
probably a good idea. I
Yeah.
think by at this point, there's so many plant-based protein powders and everything that are, is that protein all over your face?
Good is.
Perfect. As I'm speaking about protein powder.
No, it's my morning green shake as it
Oh,
decided to
nice.
clog up and fall over. You
Oh,
give me
no.
just a second.
No
Hold on.
problem.
I'll be right back. Continue on.
I will continue on. What was I going to talk about? I was going to talk about I kind of briefly touched on, fill it, have your protein, and then fill in your carbohydrates and fats as wanted. And that one is going to be highly contested too, because there's a lot of people who feel like you need to eat low carbohydrate. There's other people that maybe feel like you need to eat high carbohydrate and lower fat. And I would say neither are really true. And this has been shown in the data repeatedly that diets work whether they're high fat or low fat, high carb or low carb. It really is going to come down to calories at the end of the day. And so I will tell my clients, I'll tell myself, whatever feels best as far as what gets me through the day and what gets me through my workouts the best. So for me, as I was trying to lean out historically, I always felt a little bit better with higher carb and lower fat, because I was pretty active as far as doing things like CrossFit and bodybuilding and things like that. So I felt like I needed more carbohydrates in order to fuel my workouts. And so I ate higher carbohydrate, I ate lower fat. I also felt for me that I was able to get more volume of food eating more carbohydrates than I would if it were fat. So, for example, 100 calories of peanut butter is, about this small. And then 100 calories of rice, you're almost getting a bowl portion. So for me, I felt like the volume of carbohydrates would be able to keep me full. There's other people who function and work really well on high fat and lower carbohydrate. And if that's you, that's totally fine. So were you able to hear all that spiel I just
Yes,
did, Josh? All right,
I
cool.
did.
So would
I
you
did.
agree or disagree?
Yeah, absolutely. And it's, again, as you were saying, kind of what works best from you and the standpoint of how it makes you feel. Cause I would say I've always been on the opposite end of the spectrum where much more moderate carbs and higher fat works better for me, as just far as how I feel.
Yeah.
So you definitely have to kind of, it's weird how it is so dependent from person to person like that. But yeah, you kind of just have
And
to
then,
find what works best for you there.
yeah, it's really the works best for you. So when we say this, it would be easy to be like, well, Josh got leaner than Adam. It's, it's the high fat superior, but it's really not. I mean, like I said, if
Mm-mm.
you look at the data definitely suggests that it doesn't matter, because you can
Yeah.
take a group of people eating the same. If you equate for protein, which is what a lot of these studies did not do when they said that high or low carbohydrate was superior, they never equated for protein. They never equated for calories. So, if you just pull out carbohydrates, usually you're going to, reduce calories
Yeah.
that way. And so that's where those diets won. But if calories are equal, not going to be a difference.
Yeah.
It's really going to come down to how do you function better. And you might not know that yet. So that's something that you can play around with in your day-to-day diet. You can try to do a day of eating higher carbohydrate and lower fat, and you may feel really good and feel like you have a lot of energy, or conversely, it may make you feel really sluggish. And so, just you can tweak it that day, just leave your calories the same. And that's a nice part about weight loss, is it doesn't need to be as restrictive as a lot of people make it. Um, that's where the if it fits your macros group gained a lot of popularity, because historically losing weight was a painful, tedious thing where you had to restrict all these crazy foods, or you had to pull out carbohydrates completely. And then, they just looked at the science for like, hey, you don't really need to do this. And, there was the guy who did the Twinkie diet, who he ate nothing but Twinkies, and he lost a significant amount of weight. And importantly to note too, all of his blood markers actually improved. So his lipid levels went down, his metabolic health improved, which is interesting because he was eating pure crap. But at the end of the day, calories are king, and it's always going to be the thing. So you can certainly make an argument that you need to eat more nutritious food than Twinkies for health and longevity. But if you're simply talking about body composition, it's going to be calories. And so that's one way we've talked about is basically, I think what we've been talking about here is more of the if it fits your macros point of view, the calorie tracking. But there's more than one way to eat in a deficit. I think when I'm talking to people who listen to us, they're probably a little bit more on the cutting edge of either fitness or bodybuilding or something like that.
More
and
on
I
the
think
performance side.
Exactly. On the performance side, I do feel like the best route is through actual tracking and knowing to a T how many calories you're burning because there's nothing to guess. Now, if you're just, the guy who asked for this video, for example, say he's just a guy who wants to lose weight, but really doesn't care that much about his performance, and he doesn't care, about getting a freaking 12 pack, then fat loss can go, and you can do other modalities. So again, you just have to eat less than you burn, but there's a few ways to do so. So we talked about actually tracking your calories throughout the day and knowing what your deficit is. There's other ways that work for people. One is restrict a food group of some sort. So like the keto group, they literally take out all carbohydrates. And by doing so, usually you end up eating less calories because now you've taken all of these foods that you can no longer eat. So inherently, you're probably reducing your caloric intake. Now, it's still completely possible to gain weight using keto because you can still eat in a caloric surplus. But most people will not because, again, protein is so satiating and so is fat. So most people are going to get full and be uncomfortable before they overconsume. So that would be one way. I would say it's not as accurate, if you're really trying to dial in, if you have a show coming up, it's not a good idea to just be like, I'm going to pull out carbs because you can't really monitor things as well. If you're just a normal person who needs to drop 20 pounds to be healthier, sure, it could work. The other way would be time restricted eating. So that falls into the camp of, what do they call it? The intermittent fasting or IF, people will say. I think time restricted feeding is a little bit better. And that is basically giving yourself a window of time to eat. So people will say, maybe I'm only going to eat between the hours of 4 p.m. and 7 p.m. So you now give yourself only a 3-hour window and the rest of the day you're fasting. As you can imagine, you're probably going to not eat as many calories as you would if you were able to eat throughout the entire day. You might only get one meal in and you're going to drastically reduce your calories. Again, probably not the best for the athlete or the competitor, but awesome and really good for the basic individual, if that kind of thing works for you.
Yeah. And I guess too, I would also say on that point, I think some people like the cognitive benefits from the intermittent fasting as well. Just kind of to start their morning out on an empty stomach. Obviously, you're keeping blood glucose levels low, which kind of in the same camp as why some people like the ketogenic diet. They feel like they get a cognitive boost, not being bogged down from having carbs in their system. So, to your point, if you're not looking at it from a performance standpoint in the gym, there also can be just some added benefits from how you just feel on a day-to-day basis.
Yeah, and I think even if you are doing more performance, you can make any of those work too.
Of course.
My point is you can't get as granular with those because you're kind of just estimating. You're not you're not tracking calories, you're not weighing things, and that's fine. And again, you don't have to. I mean, you can even eat less calories throughout the day without tracking or anything. But our point was simply that you should probably do it a few times just to understand what serving sizes look like or to understand where you're at to start with. Yeah. For me, I've had really good success with intermittent fasting in the past. And that was even when I did have more of performance goals in mind. My biggest bout with intermittent fasting was in undergrad. I got pretty big. I went on a kind of crazy dirty bulk, I guess one would say, where I was, yeah, I got nasty. I was eating like donuts in the morning and cinnamon toast crunch all the time, and any food that I hadn't eaten for years because I thought that it was like bad. This was in the time of like the if it fits your macros, and I was like, that's like when it first came out, and I'm like, this is amazing because it
I'm
made
finding a way to
sense.
make it fit.
Yeah, I'm like, this makes sense. And I'm bulking. So why am I bulking on, broccoli and chicken and brown rice is disgusting. I can start eating things that I like. So I started eating a ton of cookies and I wouldn't do that anymore, but I had my time. I got pretty fat, but I got pretty big too. And then I was in college and it worked really well for me to get lean, to just not eat through most of the day. My buddy and I, Austin, who's now a dentist, him and I would basically fast all day long. And then we would go to our favorite burrito joint after classes. And I could eat again, like my favorite food's Mexican food. And I was on a diet and getting to eat my favorite food, but it was the only food I was eating all day. And so it would end up probably, I'd probably only be eating like 1,800 calories because I'd have some chips and a burrito and everything. And I lost a significant amount of weight with so much ease. I didn't feel like it was hard at all. Because from the moment I woke up to when I was eating burritos, I was so busy with classes that I wasn't, concerned with food. And it worked really, really, really well. And since that point, I've basically stayed pretty lean. That was like, I did a pretty aggressive one. And then after that, I've never bulked up again to get fat. But that worked to get me, I have year round abs. And if I'm looking back, I've had them since that period. So it was highly effective. Have you ever done intermittent fasting like that for an actual weight loss?
Not for an actual, I guess, like goal of weight loss, simply just because it was something that I enjoyed too. Kind of on your point of it's nice not to always have to worry about food so much too, of just like, hey, I'm going to wake up, start my day, and kind of not even have to think about it. And then, you know, I know the science differs on it, but I always like the idea of like, hey, throughout the day, like my body is basically just working off of what I fueled with the day before. It always seemed like I had better digestion that well too, or that way, as long as I was not just gorging myself during my feeding window in the afternoon or the night before. So I definitely have had good results with it as well. And as I mentioned earlier, cognitive benefits from it too can be really nice. Just a little more mental clarity, not having any far carbs kind of bogging your system down.
Yeah, for sure. What kind of protocol did you run when you were actually dieting for shows?
That was definitely much more moderate. So I would say that was kind of on the side of, as we're talking about, just kind of a balance between high protein, moderate carbs, moderate fat too. And then as we got closer to the show, slowly pulling out carbs, just kind of for that final fat loss phase of it. But nothing ever really like, I guess, really crazy as far as just trying to push it being only keto or high carb, low fat. So yeah, always, and I always feel like for most people, that's the best way just to have that energy balance and keep you from feeling like absolute crap, especially when it is a performance oriented goal or show or anything like that. Would you feel the same?
Yeah, for sure. Yeah, so I mean, I think that's hopefully a good overview of what it takes to lose weight, which is like, at the outset of the show, it's literally consume less calories than you burn. And, you can increase the burn portion of things or you can decrease the intake side of things. Usually easier to decrease the intake because it's hard to burn calories through exercise alone.
Hmm.
Another quick little rant on that is I would personally turn off, like if you are using, say, MyFitnessPal or Chronometer or whatever, a lot of times it'll ask to link to your Apple Watch or your Oura Ring or whatever and count your steps. And then they're going to give you calories based on that. I knock that off right away. Like I tell everybody cut that out because it's going to probably overestimate your
Yep.
expenditure as well. And
Yep.
again, when you're in a deficit or you're trying to be in a deficit, it's always better to overestimate your calories too that you're taking in. Kind of, you want to, yeah, so you always want to how did I say it? Yeah, overestimate your calories you're taking, underestimate your expenditure so that you
Hmm.
hopefully end up burning more. And those things just aren't accurate. So I just cut them out. I mean, you can give yourself a steps goal, but don't base your calories on it, I would say, because they're going to be wrong. Also,
Yep.
our bodies adapt, like if you're walking every single day, just going to be arbitrary numbers here. But if you're walking every day, the first time, maybe the walk is harder for you and you do require more energy. But by, a year of walking that same route every single day, your body adapts. It's much more efficient at doing that. It's not necessarily going to burn as much calories, especially if you've lost weight and things throughout that time. So I just don't look at those calorie tracking devices at all. So yeah, overall synopsis: eat less, burn more. Easier said than done, but we gave a few different modalities that you can do so. Now maybe supplements, which is a big one. People always want to know what supplements work. This episode is brought to you by Marek Health. As you know, at Atlas, we're extremely passionate about optimizing all aspects of the human condition. And we believe that starts with one's health. But before we start optimizing, we need to know what we're optimizing for, and we need to know where you're starting. That's why we partner with Marek Health, where you can stop guessing about your health status and actually get a look under the hood. Marek was co-founded by our friend Derek over at More Plates, More Dates as a place where the individual could take their health into their own hands. Marek is a telemedicine company that uses blood work and other metrics to provide valuable insights into how your body is functioning and what might need to be changed in order to improve your performance and longevity. With Marek Health's comprehensive lab tests, you'll receive biomarker feedback with actionable steps to improve your metabolism, your libido, your mood, cognitive function, and so much more. Once you get your labs done, your personal health coach will find a licensed medical provider in your state that can help you to develop a treatment plan. So we worked with Marek to provide our listeners with 2 panels. You can go over to marekhealth.com/Atlas and order our panel for 10% off using code ATLAS. Choose Atlas Lab Panel and pair it with a lab review from a health coach for a thorough analysis of your results. That's marekhealth.com/Atlas and use code ATLAS at checkout. You can also order your own desired labs and use code ATLAS to get 10% off your first order. And that took me so long to film, so please go do that, guys. And I would say, supplements are just that. They're supplements, of course. They can be useful, but they're not going to get you the goals. The diet and the exercise is going to be the 99%, and the 1% can help in some ways. And so there's going to be 2 different types of supplements: either supplements that work on the calories burn, or the calories out equation, or the calories in equation. So the calories out are going to be thermogenic. So things that increase your basal metabolic rate, things that increase your cardiac output, your body temperature, things like that. So supplements, caffeine, probably the best one that there is. Caffeine will increase your thermogenic, output. But how many people drink coffee every single day and aren't lean? So again, it's maybe 1%, you can stack it appropriately, and we're going to get probably in the realm of medications here and steroids and things a little bit too that aren't legal. But people will use like caffeine and what is it? It's a caffeine and aspirin and
ephedrine.
What's that? Ephedrine? Yeah.
Yep.
The 3 of them, right?
Yep. The ECA stack.
Yep.
Back to the old days.
Which is essentially, you're trying to work on that calories out equation. The goal there is take something that increases your basal metabolic rate. Never use that one, but I do drink a lot of caffeine. So there would also be clenbuterol. Mm-hmm. So clenbuterol is actually more of like what would it be?
Beta 2 agonist, correct?
So beta 2. So beta 2 would be lungs. Yeah, probably. Yeah, beta. So beta 1 is alpha or beta.
I'm looking it up so we can real time check ourselves here.
It's been a while. So is it, beta adrenergic 2, and then heart would be 1. Tell me if I'm right. It's been a long time since I've messed with this stuff.
Yes, clenbuterol is working on beta 2.
So basically clenbuterol, like albuterol, is a medication for like asthma. And that's why I say, those 2, it works on the lungs, those receptors, but it again will essentially increase your heart rate and increase your sympathetic tone, increase the calories burned. So clenbuterol again can be useful, but if you're eating in a caloric surplus and you're taking clenbuterol, you're not going to be doing anything, so this is going to be a few percentage.
And I mean, then obviously you stack on the negative side effects of clenbuterol over the long term too, just from cardiac issues and things like that. It certainly would not be my go-to as far as most individuals for fat loss. So even those that are competitors and serious athletes, I feel like there's better avenues that you can take.
That one's one of those ones where it's like everything, the dose and the
Hmm.
poison is in the dose,
Hmm.
because at lower doses it can actually be like cardioprotective, it can actually be anabolic. So a
Hmm.
lot of times you'll see studies done on mice and cattle where they give clenbuterol as an anabolic aid, which is interesting because that's at a lower dose, so it can actually be anabolic and probably translates into humans too, but more so in women because women are highly sensitive to the agent. So some women will find that clenbuterol is anabolic for them and it may help them to preserve more muscle.
Yeah.
Guys, probably not as much, but it's just an interesting little anecdote on that. And no, I'm not going to talk about doses or anything, but I will say if you're going to use that, I've always found start as low as possible. So
Hmm.
whatever the starting dose is, start even lower than that and work your way up. My own experience with it, like the first time I ever ran it was awful. I started like way too high, and I was in college too at that time. I had to work that day. I worked on in a an undergrad for a little bit. I worked in a vineyard, like in a wine cellar place, a wine tasting place, a really nice one. And I'd have to walk around and like pour wine, and I was literally
Hmm.
like, oh my god, it was, and I felt like I was going to throw up the whole time. Like I was kind of cold sweating. It was awful. I did not feel good. So
Yeah.
definitely, but if you titrate up, it works a lot better because you don't
Yeah.
feel those side effects.
Yeah. Absolutely.
What else? I guess, yeah. What else works on the calories out side of things? I guess all anabolics in general.
Hmm. And then the Yohimbine side of things, and I know now I'm gonna forget the version of it. That's Raul sign,
Yeah,
correct?
raw spleen or whatever. Yeah,
Yes, that supposedly negates a lot of the negative side effects that you get with a normal Yohimbine HCl, which a lot of people can kind of get the same effects that you're talking about. Very shaky, cold sweats. I've personally taken just regular Yohimbine, and it makes me feel like crap. But I have heard of people getting good benefits from Raoul's side.
and I think that one kind of works on both sides of the equation because it also will make you feel satiated and not as
Hmm.
hungry.
Hmm.
So it kind of acts as an appetite suppressant too. But basically, any anabolic will increase your basal metabolic rate. It will help with nutrient partitioning, kind of making sure that the stuff that you're taking in is going more towards protein synthesis, protein accretion, putting on muscle rather than being stored as fat. So that's why people are usually a little bit leaner if they're running anabolics than they would be otherwise. Or if you have optimal levels of testosterone, you're going to put more food that you take in towards muscle rather than being stored as adipose.
Yeah.
Um, I think those. Oh, and the other one would be thyroid. So
Of
T3 is
course,
usually the
of
go-to,
course, of
cytomel or
course.
T3, which most people know thyroid is going to regulate the metabolism. So again, by having more optimal levels of thyroid, you do theoretically increase your basal metabolic rate. The levels of thyroid that people take usually are too high, I think. I certainly took way too much thyroid for way too long, and it definitely has a catabolic effect as well. And what
Hmm.
I found is it made me look really flat. And bodybuilders know this too. And that's why they pull it out before shows because it definitely inhibits your ability to store glycogen within the muscle and look full, which you want to be as full as possible while you're dieting because otherwise you just look, like a bag of skin. It can be hard to get a pump when you're taking it. So bodybuilders will use small amounts of T3. We're talking really teeny amounts. Like sometimes it'll be like 10 micrograms. These are for huge, like 260-pound
I was gonna say
bodybuilders.
the most I ever used was 12 and a half. Yeah.
Dude, I use like 100 or something.
Oh my
I'm not even
gosh,
kidding.
yeah. Yeah,
I
no,
just,
I've even had gone up to 25, for a couple days one time, and that was enough to kinda give me like, "Oh my gosh, I'm feeling off the wall here."
yeah, it'll increase your heart rate and you feel like you can't sleep as well. But the reason I went up that high is because, like everything else we've talked about, I didn't find it to be as beneficial as I was led to
Agreed.
believe. I was like, I figured that if I touched this mystical thyroid T3 stuff, I was going to get shredded. And, a month in, and I'm still like losing weight at the same rate that I was before it, maybe a little bit better. So I'm like, let's up the dose. And I kept upping it, just self experimenting, didn't really do much.
Yeah.
But it could be a valuable tool in some people's stack. I would just say I think it's over. It's kind of hyped up beyond what it need.
I've always
Um,
wondered if it's a male to female thing too. Just females seem to respond better to thyroid hormone too, have more
yeah,
deficiency than guys. So I've
true.
always wondered if it's one of those things that you don't feel it as much for a man throwing it in, whereas if female competitor or performance athlete, they may get more of a boost from it than you and I may have. Because we
Probably
certainly see
so.
that from a clinical standpoint too.
Yeah. One other, I guess, kind of calories out ish doesn't really work on calories, but more on like fatty acid liberation, oxidation. Two of them, I guess. One, growth hormone.
Hmm.
So growth hormone, will help to basically liberate fatty acids and oxidize fatty acids at the cost of, like we've talked about before, at the cost of potentially decreasing your insulin sensitivity or increasing insulin resistance. But growth hormone in a fat loss phase can be beneficial for that. Also, it can maybe preserve lean mass. I guess there's an argument there that you could potentially hold on to more mass if using it. So that would be what growth hormone is used for, and then L-carnitine would be the other one. A lot safer than growth hormone, and that it's simply an amino acid. You've been exposed to it every time you've eaten meat throughout your life. It's not something you're probably going to overdose on. But L-carnitine will basically, again, help to liberate and shuttle fatty acids into the mitochondria. So when you're in that caloric deficit, you are theoretically, hopefully, shifting the fat source more towards, or
Hmm.
the energy source more towards fat.
Yeah.
And that, people
Performance
would
added
debate.
benefits from
Yeah,
L-carnitine too. If you're an
for
endurance
sure.
athlete, things like that. I think I forget the exact story, but some of the Nike athletes got busted for that a few years back of doing intravenous L-carnitine, and I think it was like a 7 to 9% increase in performance. So
Yeah.
definitely not only just a fat loss aid, but potentially performance benefit as well.
I don't think they got in trouble, right? It was just kind of documented because I think it's legal, but
Yes.
it's legal up to a certain like amount. So
Yes.
again, I'm not sure if this is the number. Let's just say 50 milliliters. I think they were using like 49.5 or
Hmm.
so,
Hmm. Yeah.
and they were straight IV and stuff. So yeah, it's highly effective for increasing endurance. So I think L-carnitine probably has the most utility in the fat burning phase. Um, so is that all the calories out ones?
Yeah, I mean, and not going down like yeah, never mind. There's are some other things, but ones that I wouldn't recommend. So yeah,
Wait, I want to hear these ones. Let's talk about it.
I was
No
gonna say
restrictions.
cardarine,
Oh, okay.
GW 50156, or I believe
Hmm.
that's it. That definitely works actually very well, but I'm always kind of concerned about the long term ramifications of using that. I mean, just because there are some rat studies that did document cancer increase or risk. And obviously, I know that doesn't extrapolate out to humans, but still kind of like, maybe not worth the risk there.
Yeah. So that one is a PPR gamma receptor agonist, and PPR gamma has to do with improving insulin sensitivity, basically, and has to do with fat storage. And so it can help to reduce fat, and then most importantly, like visceral fat, which is really cool because that's the fat that is detrimental for longevity, as that's the fat that basically all fat cells will kind of excrete inflammatory markers, and the visceral fat that's around organs is shooting basically inflammatory markers into the organs and damaging them prematurely. So whatever you can do to decrease visceral fat is great for health and longevity. Not this conversation, because we're talking more about subcutaneous fat, but that's really cool in that regard. And it also dramatically increases endurance. But yeah, as Josh said, what it was actually going through clinical trials because a
Hmm.
drug company, I can't remember which one now, was developing it to increase HDL and help to reduce visceral fat, which would be great for people with metabolic syndrome who have low HDL cholesterol and a lot of visceral fat. However, they put it through and so this is something that I get annoyed with on like the forums or people who kind of promote cardarines. They say the doses that they gave the rats were so crazy they would never translate into a human. But the thing is they went through the normal standard clinical trials that every other drug goes through. So every drug that we take, telmisartan, for example, which is another PPR gamma receptor agonist, like they took the same amount of drug and gave it to the rats at that dose. And these rats were developing cancer at all the doses that they gave them. And so, yeah, they're higher doses, but it's standard dose that we give to approve a medication. And it couldn't it didn't live up to it. It was too dangerous. And so you can take your own chance. I certainly have, and Josh certainly has. We've both ran it multiple times, and I sure hope I never develop cancer one day because of it.
Hmm.
But I wouldn't take the risk, and I would advise people not to at this point. I didn't know this stuff back then. I kind of just blindly listened to the forums. I was like, oh, the dose is too high. It was stupid. But then I kind of dug into it and learned more about clinical trials, and I was like, oh, well, that sucks because every other medication also gets put through this, and I'm safe because of that. So,
Hmm.
any other ones?
Not that I can think of off the top of my head. Yeah, no, that's it. And maybe I'll think of something here in a bit, and we'll do another video someday. But yeah, kind of the heavy hitters, I would say, are the ones that most people are going to be most familiar with.
And then the other one would be the calories in part. So anything that's an appetite suppressant.
Hmm.
So now probably the biggest one on the market is a GLP-1 receptor agonist, which
Yeah.
I just did a podcast with Fuad. If you guys haven't seen that, go check it out. But you have liraglutide, semaglutide, tirzepatide, all of these that are GLP-1 agonists or glucagon-like peptide-1 receptor agonists, meaning that they act on the glucagon-like peptide-1 receptor and kind of do the things that that receptor would do, which is slow gastric emptying and cause satiety or make us feel full. So they work really, really, really well at that. Twofold. One is they work at the part of the hypothalamus that reduces hunger, so you don't get that hunger craving, that feeling of hunger. Then when you do eat, and like we talked about, your gastric emptying is slowed, so your stomach fills up much quicker than otherwise would, and you feel full. So you don't feel hungry and you feel full, leads
Hmm.
to less calories in. It's great for somebody performance-based. This is a conversation I have with Fuad. I don't think it's maybe the best because it can be hard to get the amount of protein in that you need. So if you're running something like this, prioritize protein just like you would otherwise.
Yeah.
We've also done a video on this on like back, talking about does Ozempic make you lose weight? So if you guys are more interested in that, go check out Fuad's or our other podcast on that. But that's probably the best appetite suppressant. And then as we talked about, yohimbine can work. I
Hmm.
think clenbuterol can actually be an appetite suppressant. You could argue that there's a lot of anabolics that are appetite suppressants.
By making you feel
Funnily,
so toxic.
exactly. Yeah, I mean the anabolics are usually more the ones that people take during a bulking phase, something like Anadrol. But a lot of
Yeah.
guys will talk about how full or how nasty it makes them feel, and they can't get the calories in. I'd say the best appetite suppressant is just eating more fiber too is big. So
Absolutely.
fruits and vegetables are going to be your best friend when you're dieting because, a big ass bowl of lettuce, like salad, you're going to maybe get 40 calories out of all of that lettuce and you've got a massive bowl. So you could do a, big bowl of lettuce and then like a Greek yogurt dressing, like we use the Bolt House ones. Those are great, low fat, high protein, and then a protein on there. You can even add some carbs of some sort. I don't know, like we air fry up tortilla chips and everything,
Hmm.
and do like tortilla crisp, and you can make a delicious salad for, like 400 calories. That's massive. So as far as like appetite suppressants, I would say food can be your trick there. Hydrating yourself, everybody knows that, but if you're drinking a lot of water and your stomach's full, or carbonated drinks too, and I don't mind diet soda. I think any effect on insulin or gut microbiota is not well established at this point, and we know for a fact that people who drink diet soda usually take in less calories than those who don't, not
Hmm.
surprisingly. And so that's going to be at the end of the day. So if you like diet soda, it can be an awesome hack through a cutting phase
Yeah.
because, if you're looking for something sweet, having a can of Diet Coke may kind of work well, and it will fill you up too. And if you're against the artificial sweeteners or whatever, have one of those sparkling waters or something,
Yeah.
that
And just the
can help a lot.
carbonation alone sometimes can give you that satiated feel.
Yeah. Anything else that you can think of that works on appetite suppression?
Milano tan.
Oh
But
yeah.
that's more of just
Yeah.
a side effect from that of making you feel nauseous. So
Yeah.
I wouldn't recommend that as an appetite suppressant. That's more of a joke. Um, I think you kind of nailed everything.
I forget. I'm not really just like when we talked about peptides. I don't think about growth hormone peptides or anything anymore. Just like these, like I hadn't thought about Clen in so long,
Yeah.
and I'm not a pulmonologist. I don't deal with with inhalers and things of albuterol or clenbuterol. At this point, I just don't think about these things. I need to. Yeah, I used to be like so well versed in them because I was like always trying to find the latest hack. But honestly, at the end of the day, guys, like food, like I've maintained a 6-pack for years now, and it's only through food. Josh and I had a conversation on the phone the other day, and I talked about how little my caloric expenditure is at this point, just due to how busy I am. I'm usually right here in front of my computer all day long. I do stand all day, so that helps, and I do walks around the building, which helps. But I don't, I'm nowhere near as active as Josh is, but I still maintain we probably have pretty similar body fat. And I do that simply through my calories in portion. I just eat less because I know that I can't afford the calories that I once did. So at the end of the day, it really, truly is that simple. I hope that you guys listen to the beginning of this video more than the second part, because again, these supplements, whether they be, steroids or just over-the-counter supplements, they're not the thing that makes or breaks you. It's the diet and the expenditure more than anything else.
Oh, absolutely. And I mean, and it goes back to, we always harp on consistency. Like, it takes things a while to become the new normal for your body. And you do have to remember that even when you start, in quotes, dieting, like, your body can have a yo-yo effect at times, just because it's still like used to maybe how you were for a while, or the amount of body fat that you were carrying around. And it can, as you were saying, like, it took you almost like years of doing things and being strict then to like hit this certain level of leanness that now you can kind of maintain. That's not going to be something that you just get in 6 months. It takes time just to build more muscle mass, which is going to obviously increase your metabolic rate, allow you to be more insulin sensitive. Like, those things take time, but if you do put in the work, it kind of becomes your body's new baseline. So as Adam's saying, then you almost have a little more flexibility to where maybe you don't have to be so as crazy with your working out schedule, and you can kind of keep the physique or level of leanness that you like, just based upon by making smart food choices.
So let's say a guy who's listening doesn't work out really at all at this point. He's not fat, but he's not skinny. He wants to build muscle. He wants to look jacked, but he's got that layer of kind of chub. I guess you can consider him skinny fat. Would you suggest cutting first and then trying to put on muscle, or trying to put on muscle first, or what would you suggest?
First thing,
I know what I would suggest.
Okay. So first thing, of course, let's say diet's in check, like we give him, like we were talking about. And also, one thing we didn't probably mention earlier is alcohol is a huge killer. I know Victoria shared that the other day with her reel that we put up through Atlas. But that's one to pull out almost immediately, or decrease it as much as you can, just from a decreased recovery standpoint. Obviously, all the extra calories that you're adding in also messes up with your body's efficiency when it comes to using calories too. So definitely pull that out. Diet in check as far as maybe a gram of protein for body weight, moderate carb, moderate fat. But I would recommend really kind of doing a mixture of both. Like, let's not try and like put you on a bulk or put you on a cut. Let's just have, hey, here's the healthy diet that you're going to be following now, and let's add in a good mixture of resistance training and some cardio in there as well. And I think just by doing those things together, you're naturally going to get that recomposition effect as it is. And then once you get comfortable with that, and you've maybe lost that layer of fat, put on a little muscle, if you want to push it one way or the other, then you can maybe get a little bit more granular with your focus.
Yeah, we have the same exact answer. Because I was going to say, in the beginning, when you're that person, when you're untrained, it's probably one of the only times in your life that you're going to be able to simultaneously burn fat and gain muscle. There's some magic that happens with newbie gains. It's really true. And so if you're that person where you're kind of in between, where you're just kind of a softer guy, I wouldn't focus on either. I would just start lifting and starting to eat at maintenance, maybe even a slight surplus, and you'll probably be able to change your whole body composition pretty significantly, which is cool. And then if you're on either end of the spectrum, I mean, if you're skinny, obviously just get big. But if you're, big, maybe obese or so, obviously the main goal is at this point going to be to lose weight. But you too, even in a very obese individual, is likely going to be able to be gaining muscle underneath that while being in a deficit, which is really cool. So I think those people understand, like, I just need to lose weight. There's not going to be any obese person asking, should I bulk? But there's always the guy who
But
is
maybe
kind
the
of in between.
modality of how to lose that weight, though. And I think that's definitely a common misconception is that you're just going to, fat loss is all going to come through your cardio. And
Mhm.
they negate that, hey, but by you building more muscle, that's automatically going to pull a lot of that insulin or glucose that's floating around in your system 24/7, making you more insulin resistant and start shuttling that into that skeletal muscle that you're building.
Yeah.
So there certainly is a huge benefit of adding that into the
Mhm.
equation, even if you are someone you would be considered obese.
Absolutely. Cool. Any other like questions you could think of off the top of your head if you were somebody interested in this topic? Because I think we touched on it all, but
Trying to think, and we've talked about it a little bit, but I mean, if you were going to structure as far as like a game plan for how to attack this starting out, just like the person we were discussing who's maybe just in the middle, I think really something is 3 30-minute zone 2 cardio sessions a week and 2 to 3 full body resistance training sessions a week is really like a great base point to start with. And once you get comfortable with that, if you want to add in a little bit more, you certainly can. But I think you're going to see pretty great results just from having a baseline structure
yeah,
like that.
for sure. I think Josh is definitely more of the exercise guy, and you think more of that. And I almost don't even think about exercise. Like I
Hmm.
said, when I talk to people, I would tell them not even to think about exercise as being a
Yeah,
modality that's helping in any way, because I think that the bulk of it is going to come through the food, because that's really the thing that we can tweak the most and the thing that we
oh,
have the
true.
most
Yeah,
control over.
yeah,
Obviously, continue to exercise. It's going to help, but I wouldn't even think about it as being part of my equation because it's just easier for my brain to do that.
hmm,
And I think I'm like most people, and so I think a lot of people fall prey to what just worked out. Now I can eat a little bit more, and I would
fair
say
point.
screw it. Just think that calorie that workout burned 0 calories and go about your day as it would. So I don't even
Yep.
change my when I'm in a diet. I don't even change my intake on a workout day versus another. Like some people will do that, and when you learn your body good enough that you're a top level bodybuilder, you can know like, okay, my leg workout, I need to add 300 extra grams of or 300 extra calories and 50 extra grams of carbs or whatever. But for your average individual, I would almost just think of exercise as being 0 calories burned to go on about your day as is.
No, and that's actually a really good point. I mean, because if you think about it, your intake, in my opinion, when it comes to dieting, matters much more than your output's going to be.
Yeah,
So I mean, because you're having to
for
work
most
much,
people.
yeah, for most people, and you're
Yeah,
having to work much harder to offset the balance of how much if I eat too much, and then trying to offset that with more exercise, that's going to be a lot harder. Rather than just like, hey, if I just restrict what I'm eating, I'm not having to do so much back end work that's could
yeah.
possibly burn you out as well.
It's so hard to measure what we burn
Hmm.
as far as exercise too. It's
Another good
almost
point.
impossible. I mean,
Hmm.
you'd have to be put into like a big calorimeter, basically a
Yeah,
calorimeter that
yeah,
would basically measure how much calories you're burning. It would be very hard to do so. And like Victoria works with eating disorders a lot, and the people who have bulimia, and bulimia can go in various ways. It can be either you're trying to purge via throwing up, or the other aspect of it is there's a lot of bulimics who try to purge via exercise, and they're usually not that lean, because even if you're always overestimating how many calories your exercise is burning. So I just don't even think of exercise being a part of the equation. The muscle building, like you said, that's going to be one that resistance training is going to increase your metabolic rate for hours after. So you're going to be burning more calories after, you're going to build more muscle, and your body's going to prioritize building that muscle over building fat. And so it's just so many. And then, like you said, you have this massive reservoir for calories to now go into. You have a reservoir of where calories need to go to maintain that muscle. So it's building muscle is a big hack.
but also to your point, second, that's more of a secondary health benefit, I would
Yeah.
say, rather than if your goal is just to lose weight. So yeah, I like that you kind of maybe for people starting out, like it is much easier just to focus on one aspect of the equation. Because I think it can be very overwhelming trying to think, man, I got to diet, I got to make sure I work out 5 6 days a week. So do what allows you to fall into a routine that is most comfortable, and then once you get the X variable down, you can then move on to, what's going to be your next variable to add to the equation for,
Yeah.
fat loss and longevity and health.
Another thing just I thought of, like, you when you look at, like, I don't know, triathletes and stuff, some of them have some pretty big bellies on them, like,
Oh, absolutely.
yeah,
Yes.
because
Yes.
I mean, it doesn't burn as much calories as we think,
No.
so it's,
Well, your
like I
body's
said,
much more efficient and but doing a lot of
yep,
slow zone 2 cardio, it doesn't have to work as hard as it does
yeah.
as when you're doing high intensity or resistance training styles.
Yeah, I'm definitely convinced that, our bodies get more and more efficient at doing the same thing
Mhm.
repetitively, and we start to end up burning less. So, yeah, cool. I think that covers everything, all things fat loss, I hope.
Yeah,
Anything else
hope
you'd
so.
add, Josh?
Nothing that I can think of other than, like we keep saying, find what works best for you. Don't overcomplicate it. It's super easy to do that nowadays. Try and take just a holistic approach. I hate that word, to your nutrition. But don't. If I know a lot of days people see so many different styles online of you got to do this, you got to completely cut that out. Maybe don't take that approach starting out. Hit your protein requirements. Good mixed balance of carbs and fats. It's trying to stay in a deficit, and from there I think it's you kind of learn pretty easily for your own body what works for you.
Yeah. And I should have said this out the outset because I tell everybody this repeatedly, like every single day: do the thing that you can foresee yourself doing forever.
Yep.
Um, for the more granular dudes, for the bodybuilding competitor, for the endurance athlete who's training for a competition, you not talking to you guys, talking to 99% of the rest of us who are just trying to maintain a healthy lifestyle and maintain a good looking physique and look good naked year round for the rest of their life. Do something that you can maintain. So my biggest gripe with all things like, keto is that, yeah, it's cool for now and it may work really, really well for 3 months, but will you always be able to say no to the birthday cake, the pizza, anything that comes around? If that's a no, then probably not the best diet to go down because you will fail. And humans usually don't just fail, they fail and then fall completely off the wagon.
Yep.
Not many of us fail one time and go, oh, well, I'll get back on the horse tomorrow. Most of us fail and go, I'm a failure. It doesn't matter anymore. I'm off the diet.
Yep.
And so, if you have that kind of personality, which most of us do, and you can't foresee yourself doing something forever, then don't do it. So the approach is usually, like Josh said, much simpler. Pick something where you get the foods that you like in moderation, something that you can maintain. Like if you can eat carnivore or keto for the rest of your life, awesome. That's super cool because it's going to maintain your goals forever. Most of us aren't that way. So just do something that you can maintain. So I would say. And if you need help with this, the Atlas has nutrition coaching. We have dietitian, Victoria, my wife. We have another nutritionist, and we can help you with that. So go to the website. You can sign up and get a meal plan, or you can do coaching, anything like that. That's one thing. All of the rest of our stuff we do through Marek as far as our lab work and medication advice and supplement advice. But the actual nutrition portion of things is through actual Atlas. So you guys can go to the website and get some help on that. I should have plugged this earlier, man. I forgot all about it. Atlas is built around nutrition, and here we are talking about nutrition. I didn't talk about it the whole damn time. I'm a terrible salesman.
Hey, hopefully that means everybody got to the end of the video and gets to watch then.
Yeah, I hope so, man. Well, let us know if you guys have any questions about any of this stuff in the comments. We'll definitely reply. And thank you so much for the idea. As you saw here, if you guys give us ideas, we'll definitely we'll listen to them and make a video. So let us know what you think, and we will see you guys next time on the next episode of the Atlas Hour.
Yeah, got some great guests coming up for you guys too. So stay
True.
tuned. Really cool episodes coming up.
All right. See you guys.